Hello everyone, this is Roxanne Hall. I'm the Director of Nursing at the Lodges in Brooklyn Park. Today we're going to talk about putting on PPE. PPE is your personal protective equipment. As you can see to my left, we have all of the pieces that are necessary. I'm going to be showing you the correct method for putting it on and taking it off. There's a specific procedural method to make sure that in putting it on, you're protecting yourself while taking care of patients with possible exposure to any kind of disease, and taking it off, you don't expose yourself. So the first step is you're gonna grab your gown. This isolation gowns are open in the back. You're gonna be careful when you handle it just to grab the top parts and slide your arms in. Once you have your arms in, you're gonna tie around the neck. My gown is a little stuck, but we'll get it going. So we'll tie that around our neck. And once you've tied it around the neck, there's also a second tie around the waist, which you can do after. So we have our gown on. The next step is we wanna put our mask on. There's different kind of masks, and I know today we're talking about actual protection in a current infectious patient situation. So in this event, I'm going to show you an N95. An N95 mask is a mask that has a built-in filter. This will filter out particles from droplets. That is how COVID is spread. When you take the mask, you want to make sure you touch it by the ear loops or the loops that go around the head. You want to make sure you're not touching the front or the inside. So I would just gently take the mask like this, and you put it over your face. You can adjust it by touching the ear loops to get it on your position. We will adjust this later. The next step is to put your face shield on. The face shield is going to protect you from droplets, from coughing, sneezing, or anything else that might spray in towards the facial region. Again, we want to make sure we're touching it only by the back piece and not the mask in the front. You want to slip that over your head, and again, trying to only adjust by the straps on the side. Now that we have this on, last is our gloves. You take the gloves one at a time and put them on, making sure that our gloves slide over the cuffs of the actual gown on both sides. Once we are done, you can then touch the outer aspect of your mask to tighten the nose piece. That's that bar on the side. That should be tight flush against the top of your nose. Now I have full PPE on. I've just taken care of a resident that has an exposure to the COVID virus, and now I am considered dirty. If you draw an imaginary line down the middle of your body, being the front half is dirty, the back half of you is clean. This is how you're going to remove. You're going to take off your gloves first. All of your gloves are contaminated, so you take the glove and you pinch right here at the cuff. You want to make sure that you're not touching the inside of the glove where your hand is still clean, and pull it down like so. In that glove, you have that balled up. Then you're going to take your hand and slide that other piece off. Then you will throw those away. Next is the face shield. Again, we're not touching the front, we're touching the back. You're going to slide that off, and that's going to go in the garbage. Next is your gown. You're going to just reach back and untie it, and then you're going to reach in from the inside. You're going to be careful not to touch it on the outside because that is contaminated. And then back down like so and off. Last is your mask. You're going to take it off by touching the earpieces, sliding it off, and throwing it away. Then you're going to wash your hands. That's how you do it. Any questions, please feel free to reach out to your manager or clinical lead. Thank you.